Welcome back.
Welcome back. It's Grim. I'll get it one of these days.
Sometimes I imagine like a talk show and we're just like, fumbling around. Like, can you imagine if we were like having some like serious fucking show?
Just like with like one single fern between us, just talking. Everything in like mauve in the background. I want to wear shoulder pads if we do it.
I remember shoulder pads.
Me too. I have
Children too. Like,
full pictures in shoulder pads. I do.
why would you put those shoulder pads on children? It's so bizarre.
I looked like a young administrator. Thank you very much. I was going to kindergarten in a skirt suit with shoulder pads, and I had my hair up. I was like, "Watch out, world!" With my books. Yeah, huh?
Have a briefcase.
No, I didn't. But I always wanted one when I was a kid. Weirdly, I did want one. Yeah, I had to put all my important stuff in there, But I do. I have school pictures of like a baby blue, shoulder padded. You've probably seen it, skirt suit when I was in like kindergarten. So yeah, I guess well, we should get into this. Today we're wrapping up our medical and psychiatric crimes against humanity series, and we're wrapping it up with conversion therapy. So yeah. But we should give a trigger warning, I think, before we get into it.
So yeah, trigger warnings. This one's rough.
Yeah.
Really, really rough. So what I have is sexual violence, suicide, forced medical procedures, castration, transplantation, psychosurgery, and abuse of LGBT.
Yeah, and I have crimes against children, hate crimes specific to the LGBTQIA plus community, health and human rights violations against adults and children, suicide, and murder. And that gives you just a taste of what we're getting into. And it's gross, guys. It's real gross. But what's up?
Absolutely.
Yeah. So we're just going to dive in because there's a lot of information coming your way. And if you don't know what conversion therapy is, I'm going to go ahead and give us like a little bit of a background and why we added it to the series really to begin with. So conversion therapy is an umbrella term for what are discredited and dangerous practices that aim to change a person's sexual orientation or gender identity. It has been condemned by every major medical and mental health organization as harmful and ineffective. At times, these practices have been referred to as reparative therapy or ex-gay therapy and have been used throughout history in a variety of ways. Exposure to conversion therapy has been shown to have adverse health effects. People that have gone through conversion therapy experience PTSD, anxiety, depression, and substance use at higher rates than the average person and are twice as likely to commit suicide. Considering the gender identity and sexual orientation are neither mental illnesses or disorders, it's a severe human rights violation to expose anyone, especially minors, to this form of therapy. So now that you know a little bit more about what it is, I'll let Amy explain why this happened in the first place.
So why conversion therapy and homosexuality, especially today's sexually shifted men, was considered deviant, simple, and was against the law for centuries. In the late 19th century, psychiatrists and doctors began to address homosexuality as considering a disorder, and they began looking for ways to reverse it. There were many theories about why people were homosexual. For a man named Eugen Steinak, an Austrian endocrinologist, homosexuality was rooted in, so others feared that sexuality was a psychological disorder. And Sigmund Freud hypothesized that humans were born innately bisexual and that homosexual people became gay due to their upbringing and surroundings. Freud emphasized that homosexuality was a disease, but many of his colleagues didn't agree. So they began new psychiatric interventions in an attempt to cure gay people. It's basically rooted in people not accepting what they're doing and thinking that being gay is
Yeah.
deviant behavior. I feel like it's really stemming from religious beliefs and what's really bizarre is that many cultures throughout time, like, it's something that is very normal, gay relationship, homosexual relationship. And
Yeah.
what's really also bizarre is that men have like, I understand that there's a huge issue, like, homosexuality, like, with different genders, but it seems like men have really taken the brunt. Not e like, I don't wanna say that what happened to lesbians as, like, not as much, but it seems like
Right.
so many more people are deeply offended by gay
Yeah.
men, like, maybe it doesn't matter if a woman is gay, that they're going to just do what they want with them regardless,
Mhm.
and they need to fix the men. I'm just throughout this research, it's just been
Yeah, yeah. No, I get it. Like all queer people or, they all have been like, what is it? Like hurt, they've all been hurt by society. But like, I feel like sometimes policy didn't even recognize like lesbians as like serious enough to make policy against them or something. Whenever there would be specific sodomy laws to try to stave off homosexuality specific to men. So yeah, I could see that where it looks like there's kind of more hate towards the homosexual men than there is, a lesbian or bisexual person or trans person or whatever. Not that we're saying, but we're going to get into it, guys. Everyone in this community has been profiled against, has been aggravated against in sexual ways and violent ways and in psychological ways. Like this community has really gotten hurt over the years. Really gotten hurt in every way, every level. I think I don't even know. It's like I can't think of a way that they have not been hurt by society. You know,
I'm stumbling on words here because it's actually so horrific, it's hard to fucking like,
that's
it
true.
seems like nothing that I say really describes the severity in which what has happened.
Right.
Um, so yeah, like I said, we'll get into it.
Yeah, we will. And it's guys, that's what yeah, I'm also stumbling because I almost want to like cry but thinking about it and some of the stuff I've read and like some of the reports and some of the stories are like I mean really make I can't even imagine these people living through it and retelling this story and surviving some of this stuff because just hearing the story like literally brought me to tears and made me want to like hide in my room and be depressed all day from knowing it and not having experienced it and not having, it's bad. Anyways, back to it. I'm going to talk about a form of conversion therapy and it's called aversion therapy. This is a psychological treatment in which the patient is exposed to stimuli while also being exposed to something they dislike. There are many different forms of aversion therapy. Chemical therapy, like prescribing antabuse to someone who drinks alcohol to induce nausea. Electric therapy, where someone is given an electric shock to zap an unwanted behavior. Sensory therapy, or using negative touch, smell, or taste to avert a behavior. And an example would be like putting something bitter on someone's fingernails to stop them from biting them. So verbal or visual therapy displays upsetting imagery or sound to subvert a behavior. Think A Clockwork Orange. Aversion therapy is still used today as a behavior modification tool. Although in recent years, it has received criticism from experts claiming that it isn't as effective as other available techniques, making it unethical to use. So since the 1960s, there have been reports of aversion therapy being weaponized against the LGBTQIA plus community in a variety of ways. And this is how. Anti-androgen drugs are the first that I'll get into. These are drugs that block androgen receptors, inhibiting androgen production. In men, these can be used to treat a variety of cancers and some prostate and reproductive issues. Alternatively, they can also be prescribed to women with PCOS to stave some of the symptoms off. These medications were given to homosexual men beginning in 1967 after being diagnosed as having a sexual deviation which was the clinical diagnosis given to anyone in the LGBTQIA plus community of the time and up until 1973, when it was removed from the DSM. Anti-androgen medications would cause erectile dysfunction, effectively rendering the taker incapable of committing sexual acts, which psychiatry considered an effective treatment. This would be done both in and out of facilities, and when done in-house, consent would rarely be obtained. Apomorphine was another class of drug given to people diagnosed with a sexual deviance or homosexuality. It was known to cause nausea and vomiting. Imagery would be given to the patients along with the medication to give the user a negative projection of homosexuality. Ironically, a lot of the same medications used against the queer community in the 50s to the 60s are the same ones used to support transgendered individuals by either blocking or supplementing certain hormones. So they would use all of these medications to basically keep men from being able to get an erection and thus preventing them from having sex and curing homosexuality. Any way you slice it, it doesn't make sense. And it doesn't make sense because it's not a disorder or a disease. You can't cure something that isn't a disease or disorder to begin with, you know? So, anyways, moving on. Also beginning in the 1960s was electroshock therapy as a response to homosexuality. Both men and women aged as young as 14 to as old as 83 years old would receive an electric shock to their wrist or lower legs while watching sexually suggestive photos of the same sex in hope that this would create a connection of sex to pain and decrease attraction to the same sex. These treatments typically lasted 30 minutes in a dark room. This type of treatment was never effective, and to date, no reliable sources of information have come forward showing that it successfully reverted someone's sexual identity. Regardless, it was used as a treatment against the community from the 60s until the 90s, and earlier across the pond with some reports from the late 1950s of electroshock being used against homosexual men. So it was going on a little bit before in the UK first. All right, so verbal visual therapy was used in more recent accounts against the community. This type of therapy would have the patient subjected to a verbal assault from the person conducting the session. This could be one-on-one or in a group session where the leader would encourage others to verbally attack the patient. They would yell slurs about their sexuality while simultaneously using information gathered during therapy against them. This would have a negatively profound effect on anyone, and sadly, this method would be used against not only adults, but teens as well. Another avenue offenders would take would be subjecting the patient to horrific imagery while simultaneously feeding messages to them about their sexuality, hoping to confuse the two or blur the psychiatric line, so to speak. This would leave the patient feeling confused, depressed, withdrawn. These types of therapies have led to depression, isolation, self-esteem issues, self-harm, harm to others, and suicide, and have been found wholly ineffective, not only in the way they were intended in this space, but also as a therapy for actual disorders or mental health issues. So they really seem to try everything to subvert this community. And really, this is just the tip. This isn't even that bad. But I think Amy's going to hit us with the iceberg or the ice pick, so to speak. I'll let you take it away then.
Going into brain and psychosurgery. So, in case all of that wasn't terrific enough, it's actually going to get worse. So, some LGBTQ people were given electroshock therapy, as Roxanne said, but others were subjected to even more extreme techniques like lobotomies, amygdalectomies, and hypothalamic surgeries. And in case you do not know, the hypothalamus controls hormones and the amygdala. So the amygdalectomy was a procedure where patients were injected into the amygdala, oil, wax, or alcohol. Other times they had lesions created in their amygdala by a heated electrode. In West Germany, at least 70 men had their hypothalamus operated on between 1962 and 1979. Most of these individuals had been involuntary, institutionalized, or imprisoned for deviant sexual behavior such as homosexuality, perceived hypersexuality among heterosexual men, and pedophilia. This surgery was not commonly performed elsewhere. If you did not catch our previous episode about lobotomies and you're not sure what that is, lobotomy is a medical procedure where the frontal lobe nerve is destroyed and cannot connect with the rest of the brain, and sometimes resulting. So, like, if the scale on which like the results are anywhere from person being completely vegetative state to absolutely no symptoms, like no change at all. So it wasn't a great procedure, anyways. But this was happening to patients that were homosexual and other sexual behaviors as well. So they tried lobotomy on them to try to cure them.
Yeah.
Yeah. Yeah. And most of the patients who received these procedures did not give consent and or were unable to give consent. Uh, this is pretty bad.
It's bad because your sexual preference of who you're attracted to.
And
I cannot even. I'm sorry, I just cannot. It makes me so fucking mad. I'm infuriated by hearing about it.
so I just want everybody to know that I'm not lumping homosexuals in with pedophiles. This is the research that I've been looking at. I do not in any way think that it's similar at all. And I'm putting this information in here that the same treatments were done on homosexuals as well as pedophiles. And back then, they considered homosexuality just as bad as
Yeah,
pedophilia.
yeah,
And yeah, that was is disgusting.
it's gross.
So going on into but even more horrific shit, we're gonna go on to castration as well as transplantation. And gay men were also castrated physically and chemically. As mentioned earlier, a man named Eugen Steineck was a Austrian endocrinologist, and he theorized that homosexuality was rooted in a man's testicles. Steineck became the director of Vienna's Biological Institute of the Academy of Sciences in 1912. That year, he conducted experiments in the transplantation of male guinea pig testes into a female and the castration of the male. The testes secretion resulted in the female guinea pig developing male sexual behaviors, such as mounting a partner, led Steineck to theorize that the gland secretions were responsible for sexuality, which I just want to stop right there. My dad's female weenie dogs would hump the male weenie dogs,
Mhm.
and yet he's theorizing that this is a legit procedure. And I'm sure that there are female species of all types that mount
No, they didn't need much evidence to run with it. It was
was
it was a
like, hot damn,
prejudice.
I'm on something.
Yeah,
I'm like, I've witnessed many female mammals do similar without surgery.
yeah, yeah.
Yeah. So after World War I, Stanek attempted to change the sexual orientation of a homosexual man by transplanting into his groin one half of an undescended testicle that Stanek had removed from a heterosexual man. This procedure was doomed to failure because the immune system rejected transplanted glands, and it was eventually discredited as ineffective and often harmful. On another note, Steinach did make standardized injectable hormone therapy and was nominated for the Nobel Peace Prize, in which he did not win. At the end of his career, his research was defunded, and he was able to fund it all on his own due to procedures that were basically vasectomies performed on men to increase libido, and that was coined a rejuvenation procedure. Steinach worked with sexologist Magnus Hirschfeld on what would become a transgender surgery. So he continued working on different procedures, and uh, yeah, he did surgery. Surgical castration was widespread in Europe in the first half of the 20th century. Rick Himmler ordered homosexual men to be sent to concentration camp because he did not think that prison would fix their homosexuality. Some of the men voluntarily, and I use that term very loosely because many were subjected to severe pressure and coercion to agree to menstruation. Honestly, though, if they are gay, who the fuck are they getting pregnant?
Yeah,
You know? So the fucking castration, like, it makes it to where, they can't reproduce. I'm curious if I mean, I'm sure it does do other things too,
it does. Yeah.
with their hormones, but I feel like they're not wanting these people to reproduce. It's very confusing. So yeah. Um,
No,
anyway,
it's
so
ridiculous.
it really is. Moving on. Some who were castrated were as young as 16 years old. Those who agreed to be castrated after their conviction were exempted from being transferred to a concentration camp after fulfilling their legal sentencing. Prisoners in concentration camps were also castrated, and estimated 400 to 800 men. An endocrinologist named Carl Bernet attempted to make 8 prisoners straight by injecting them with a pellet that released testosterone. Most of the victims died shortly after the procedures. Between 1933 and 1945, estimated 100,000 men were arrested as homosexuals. Most of these men served time in regular prisons, and between 5 to 6,000 were imprisoned in detention camps. Okay. The death rate was estimated at 60%. A smaller number of these men were sentenced to death or killed immediately at Nazi euthanasia centers. After the war, homosexuals were initially not counted as victims of the Nazi regime because homosexuality continued to be illegal and their persecution was not widely recognized until the 1970s. So, chemical castration was first introduced as a method to reduce pathological sexual behavior in the 1960s with diethyl silvestrol, known as S, which lowers testosterone levels, being the first drug administered to individuals in the UK criminalized sexual acts between men and administered full castration to treat homosexuality. This was used on thousands of gay men, including the notable Alan Turing, after he was convicted of homosexuality in 1952. Turing's death 2 years later was ruled a suicide. In 2009, Turing was issued a public apology for the way he was treated. In the US, the use of chemical castration was mainly used on severe sexual deviance and not so much. I'm sure that it did happen, but I did not find a lot of.
Yeah. Yeah, and I know it is still used today, but it's used for, like, people with sexualized behaviors that have committed, like, sexual violence acts, and they need that's, like, part of their therapy is chemical castration, or maybe part of their punishment if they're a repeat offender. I'm not sure if there's any state or law that, like, would put that as a punishment, but maybe. And I know they use, Depo-Vera is common to use now. Yeah. I know they use other stuff, but I know that's also, like, the Depo-Vera is also used today, so.
I think that California was the first state to start that
Yeah.
figurative. Yeah.
Yeah. Okay. So I'm going to take us back to some psychotherapy techniques and give us a breather from the surgical stuff. But thanks for carrying the heavy load, Amy. It's pretty awful. Hypnotherapy or hypnosis was used against the community since around 1967. Although no evidence was ever produced to show this as effective in changing someone's sexual orientation or gender identity, it was used in a variety of settings until the 2000s. So for 40 years, they just kept using it, even though it didn't produce wanted results. Now, it could be done one-on-one, where a therapist would hypnotize the participant while suggesting that the participant convert, or in a group setting. There is a report from 1968 where 15 participants were put under hypnosis at the same time, and suggestions were made for them to convert to a heterosexuality, and it did not produce the wanted results, yet it persisted. I'm going to suspend this for a moment, and I just want to remind our audience of how absurd all of this is. Today, rational people understand that sexuality isn't a choice. Gender identity isn't a choice. And regardless of what those things are for an individual, there isn't a pathology of disorder for those things. Unfortunately, we know this wasn't always the case. Real doctors really believed that homosexuality was a disorder. Sigmund Freud considered homosexuality a developmental arrest and claimed that untreated homosexuality would inevitably lead to a life of delinquency and deviant behaviors. 1952, the American Psychiatric Association listed homosexuality in the DSM-1 as a sociopathic personality disorder, which, if you remember, wasn't removed until 1973. So when the founder of psychoanalysis and the systems that regulate psychotherapy both believe homosexuality is a disorder, we can only assume that any psychoanalysis or mental health treatment given to the LGBTQ community from the very beginning until the civil rights movement of the 70s and 80s was done with malintent and done unnecessarily without cause, simply because the diagnosis was inapt. So, I go back to none of this should have been done because this isn't a disorder. It isn't an affliction. It isn't a disease, But psychoanalysis obviously was done because they were doing all these treatments. They were obviously psychoanalyzing all of these people. And it just comes from a basis of idiocy, of ignorance, of just not knowing, All right, anyway, sorry, getting us back on track is gender exploratory therapy. This is when a therapist encourages their client, typically used against transgendered individuals, to explore their own gender or their own bodies pre-transition. The therapist will lean into scare tactics by giving the client false statistics and information about the transition experience and framing it as gender dysphoria. Reports started surfacing in the early 90s of underage clients being made to disrobe and explore their bodies sexually while being verbally coached by their therapist, and sometimes not even a therapist, but rather a counselor employed by the church with no license or professional experience in the mental health field at all. And as recently as 2025 in Utah, a therapist has been convicted of sexually abusing 12 clients during conversion therapy sessions, where he claimed that exploring their bodies to gauge their reaction was part of the therapy. I just can't see gender exploratory therapy as anything but a perverted excuse to get close to vulnerable bits and victimize people. That's all that is. From my perspective, why do you need to physically touch anybody's body in any kind of talk therapy session? No, that's perverted shit. Sorry, I'm going to say it is. So as you can probably already see, aside from the psychiatric community, there really is one group hell-bent on doing harm to innocent people in the LGBTQ community, and those are the Christians. Ex-gay ministries, to be precise. These are religious organizations, typically Christian, but Mormons have some, that began popping up in the 1970s. These organizations would host therapy sessions where conversion was used. They would arrange gay people to marry opposite sex to try and aid in the conversion. They would force marriage of two people. Prayer, hypnosis, and talk therapy was also used. One of the more egregious projects the ex-gay ministries began was forming camps in the 1980s, where parents could send their children to have them converted. Ran by unlicensed counselors, these camps have been closed in recent years, and the organizations that found them have been in litigation with survivors for a variety of violations. Here is what these camps offered underage kiddos as treatment: psychotropic drugs, aversion therapy, hypnosis, solitary confinement, messages linking homosexuality to the pits of hell and hell imagery, punishment, belittling and name-calling from counselors and peers, encouraged physical and verbal aggression towards each other, restricting food and water, no rights to privacy, isolation from the outside world and family, forced labor, and unsuitable living conditions. Now, this is advertised as that. What went on that wasn't included in the pamphlet was even more disturbing. Some teens that left these camps reported being physically and sexually tortured and abused for days or weeks on end by staff and by peers. they would leave severely dehydrated and malnourished. Some kiddos came back with venereal diseases, STIs, or even pregnant. UTIs and other urinary infections were common and often left untreated or mistreated. Showers would be ice cold, if given at all, and rarely private, as counselors would watch the kids anywhere they went. Feminine hygiene products would be kept from girls, and they would be forced to free bleed as a punishment. Other hygiene products would be kept from attendees like soap or deodorant, followed by name calling for smelling bad. They would bear scars from routine therapy sessions where they were struck for having homosexual thoughts. There have been multiple cases over the years of deaths occurring on these sites. In one specific case, the camp was administering medications to kids, and one of the kids had a reaction and died. The counselors were found to not have any medication administration training. Many of these camps, when investigated, would be closed for practicing therapy without a license. And today, most of these ministries, like Exodus International and Love in Action, have renounced these methods and issued apologies to members who attended these camps. For example, in 2013, Alan Chambers of Exodus renounced conversion therapy, saying it did not work and it was harmful. He closed the organization and apologized for the pain and hurt it caused. He admits that he himself has never ended his attraction to men and does not believe it is possible. And not just Alan Chambers, many of the leaders of gay ministries have renounced these practices and returned to same-sex relationships themselves, having never successfully converted. I'm curious, what do you believe should happen to the parents of some of these kiddos? Or any of the founders? You know, none of them seem to have gotten into any real serious trouble. Even when the kids died, nobody appeared to be held accountable. So, like, I'm curious, and like I'm kind of ending it off there. Like, do you think that either the parents of these kids that got sent to these camps, that where something maybe did happen to them, or the founders or the counselors, like who's responsible in this space?
In a perfect world, they would go through the exact same thing
Yeah,
with those children. That's what I would want.
right. I mean, I would imagine all of the adults would be held accountable in this situation.
Yeah, I mean, like a prison sentence, even like what community service, none of that is going to really get what they did, what those
Exactly.
children. And
Exactly.
so I personally, if I was one of those children that had to go through it, I would want them to go through the exact same thing,
Right. Right.
however long they were there.
Right. It's egregious. It's we're talking about kiddos, guys. We're talking about sometimes kids as young as 8 or 9 years old would be sent to these camps. What?
And children that young, they may know an idea about their gender identity at that young of an age, but
Sure.
they're not going to be aware of their sexual orientation at
Shouldn't
that
be.
age.
Shouldn't be. And like are you I don't know. It's just so backwards to me. It's not something that you can reverse. It's not something you can fight and run from. It's not something that can be talked through, medicated through, hypnotized through, castrated through. They've literally tried all this stuff. And gay people will still love who they love. Bisexual people are still going to love who they love. Transgender people are going to be who they are. It doesn't matter how much you fight it. You know, all you're doing is hurting human beings. You're aggressing, you're hurting, you're violating, you're abusing, you're mistreating human fucking beings when you're doing anything to try to subvert them for who they love, you know, in my opinion. But who am I? But anyways, I was just like, I think in a perfect world, all of the adults should be held accountable. I don't think that any of the kids should be punished for anything that they did or were subjected to or had to do to get out of that situation. Like if they had to punch a counselor in the face to get out of that situation, drop the charges, we're good there. You know what I mean? But like, I think the parents, I think that the guardians of these kids that sent them in the first place, I think the people that opened these places, that ran them, that profited off of these places, parents would spend sometimes upwards of like 80 grand to these places to send their kids for
Yeah.
like for like a season, for like a few months, you know? It's crazy. All of them should be in jail. Like you abused children. You fucking abused children. You should all be in jail, as far as I'm concerned, you know? Anyways, I'll let you go. I know you've got a tough one on your hands. So,
Yeah. So the next section that we're going to be covering is something known as corrective rape, and it is exactly what it sounds like. So it's now referred to as homophobic rape. So it was previously known as corrective or curative rape. And corrective rape originally referred to rape perpetuated by straight men against lesbians in order to correct or cure their homosexuality, punishment for being gay, and for going against social norms of the times. The crime was first identified in South Africa, where it's sometimes supervised by members of the woman's family or the community. So this wasn't some private thing, it was a very public humiliation if it wasn't horrific enough. And so some experiences have included female victims being told they were being shown what they were missing, while male victims have related gang rape accounts where the objective was to make the experience of being sexually receptive so violent and frightening that the victim would fear potential homosexual experiences afterward. So basically trying to traumatize them into not wanting. The South African government conducted a survey in 2009 on sexual assault. 1 in 4 men admit to engaging in sexual activity with a woman who did not consent, and nearly half of these men admitted to raping more than once. It is also estimated that a woman is raped every 26. Corrective rape has been reported in countries across the world, including Ecuador, Haiti, India, Jamaica, Kenya, Netherlands, Nigeria, Peru, South Africa, Thailand, and Ghana, Ukraine, and the UK, the US, and Zimbabwe. So corrective rape in India typically happens in order to protect the family name, to avoid shaming from religious communities, and to prevent abnormal perception by the surrounding community. Amnesty International has received reports of violence against lesbians in Jamaica, including rape and other forms of sexual violence. Lesbians reportedly have been attacked on the grounds of masculine or physical appearance or other visible signs of sexuality. And I feel like that behavior is also coming back because the anti-trans hysteria is
yeah,
happening.
incel culture is pushing it. Yeah.
Even women who are biological women, if you do not look exactly like what a typical female should look like, if you have more masculine characteristics, you're being fucking attacked. And this is, I mean, this is just telling us like how much this shit has just not died down.
No, it hasn't.
So I am going to go through a few more of the countries and what has happened, but I wish I had it because it is really fucking horrible. In
Yeah,
South
and
Africa,
I just say, like, if anybody listening ever wants us to do a part B or a second part to any of these, we're more than willing to dive back in. We know that we try to cover as many topics as we can, so we kind of shorten our episodes. We really have to edit out a lot of information sometimes, and it hurts too because it's really relevant. So, but we don't want to overload you guys with multiple parts of episodes if you're not interested. We just try to get the most important information, I guess, or the most really
the
whatever we can
current
find evidence on is what we try to push out. So we're not putting misinformation out. And that's how we edit. But like, if you guys ever want us to dive back into any of these subjects and do a part two so we can expand on this more, I'm always willing to dive into any of our topics again as on request, you know? Yeah.
so in South Africa, approximately 10% of lesbians are HIV positive, with corrective rape being the most likely cause. HIV in South Africa is an epidemic, and due to homophobia, there is a lack of education about sexually transmitted diseases among lesbians. Homophobic laws and discrimination in South Africa contribute to the poor quality of healthcare for minorities. The psychological effects of corrective rape on victims can be detrimental. Many victims in countries such as South Africa and India, where corrective rape is most prevalent, suffer from strong sense of insecurity, disempowerment due to strong homophobia in their communities. However, violence against the LGBTQ community in South Africa is rarely reported. Many survivors of corrective rape suffer from multiple types of discrimination, being women and homosexual. This is especially true in South African townships, where corrective rape is common for lesbian women. Corrective rape victims may suffer from depression, anxiety, and post-traumatic stress disorder. Due to racial and sexual discrimination in healthcare, victims most often deal with these issues on their own because they feel like they're going to face discrimination from the medical community, and they so in countries like Nigeria, where same-sex marriages are still prohibited to this day, LGBTQ people who are raped and targeted do not have the protection of the police, cannot report rape crimes done to them, as the police are likely to legitimize the abuse. Reports of corrective rape are cloaked in stigma and embarrassment, so they remain largely under sexual discrimination poses a threat to the general health of homosexual people who are the victims of rape because they fear the same discrimination from the medical community. So any medical needs that were a result of the rape, like pregnancy, TDs, STIs, go untreated. The United Nations 2015 terminology guidelines suggest that the term corrective rape should no longer be used as it gives off perception that something needs to be fixed. The guidelines propose that the term "homo- homophobic rape" should be used instead. I hope I have not given the impression that this is something that used to happen, but does not anymore. This is still happening to this day. Many countries prohibit the marriage of same-sex couples and still criminalize homosexuality. Homophobic rape is not a relic of the past. It continues in silence, hidden behind fear, and for every case reported, many more remain. So many survivors remain silent because of fear and stigma.
Yeah. Again, Amy, you did the heavy lifting on that one. Thank you. You noticed that I put your name on that one. I was like, I'm not touching that one. It was, but thank you for the
Yeah,
information. I'm sorry for the information, but thanks for the information. And you went into a lot of, like international, what's going on over there. But so America obviously has a long history of trying to convert homosexuality, but internationally, like you heard from Amy, it isn't much better. And today, most countries have adopted practices that make using conversion therapy against the LGBTQ community unlawful, but 69 countries remain, spanning across all continents. So countries like Afghanistan and Ghana criminalize homosexuality and it's punishable by death in some areas. So just for being gay, you will be killed, and probably by not a quick way either. Let's be honest. China, Korea, Africa, like Amy was talking about, and Russia, for the most part, still support conversion therapy and have also criminalized homosexuality in some or most areas. The UN is actively seeking initiatives to eliminate these types of therapies across the globe, but progress is slow due to these archaic beliefs that many governments are founded in. And although the states have rejected mostly its efficacy and use, it isn't all the way gone. But just so you know, all the aversion therapy, electroshock, use of anti-androgen medications against and not in support of all of these therapies we talked about are being used in within these 69 countries. Like they're not using any different kinds of conversion therapy. They've adopted the ones that we use. So there it still is widespread. And in the places where they have criminalized homosexuality, it's even scarier and even more dangerous for them. So yeah. But yeah, if you want to give us some more on like the status today, I guess, on what's going on with it.
yeah, I see. So, um, like you said before, all of this is still happening to this day, and people are starting to fight back. and it's not going great.
No.
So let me get some more information on that. As the 20th century gave way to the first century, right over conversion therapy began moving out of the shadows and into the courts. Survivors, advocates, and medical experts pushed back, not only with testimony, but lawsuits, governments, religious institutions, and mental health practitioners to confront the very real harm caused by these practices. Wait, Over the decades of legal challenges, survivors sued both licensed therapists and religious ministries, often arguing that they were misled, coerced, and psychologically damaged by interventions falsely advertised as treatment. Some of the earliest successful cases hinged on consumer fraud laws, a strategy born from the fact that for years, conversion therapy existed in a legal gray zone where traditional malpractice claims were hard to prove. One landmark example came in 2015 when a New Jersey court ruled against the organization Jonah, and that is Jews offering new alternative for healing. That's what that stands for. The group was found guilty of consumer fraud after promising it could cure same-sex attraction. Plaintiffs described disturbing and humiliating practices that were passed off as therapy. The ruling forced Jonah to shut down and pay substantial damages, setting precedent that fraudulent claims of orientation change could be legally challenged. They were basically saying that you can't say that you hear them, but you can still do it. You just can't say.
Right. Of course. It's all in the wording.
So another major case involved the 2019 lawsuit against California-based therapist David Matheson, once a prominent leader in the conversion therapy movement, filed after former clients alleged emotional and psychological abuse. While the case did not advance as far, it helped expose the lack of regulation around ex-gay therapies providers and the vulnerabilities of these minors brought to the programs by parents and customers. Internationally, the legal tide continued to turn. Nations such as Canada, Germany, France, Brazil, New Zealand passed laws restricting or outright criminalizing conversion therapy. Government inquiries in the UK, Ireland, and Australia documented patterns of long-term trauma, depression, suicidal ideations linked to these practices, strengthening calls for bans. Many survivors, these shifts were a form of public acknowledgement, a recognition that what they endured was not treatment, but was harm. But while global protections expanded, the United States entered a new legal battleground. More than 20 states enacted bans focusing primarily on minors or licensed mental health professionals. Yet these protections soon came under attack. Religious liberty groups, conservative legal organizations, conversion therapy defenders argued that the ban violated free speech and Amendment protection.
Boo.
Yeah,
Fucking boo.
yeah, I know. This conflict culminated in one of the most consequential cases to date. And I don't know how to pronounce the name, Childs versus Salazar. Childs versus Salazar, which reached the U.S. Supreme Court in 2025. At issue was whether states have the authority to restrict licensed professionals from performing conversion therapy on minors. Supporters of the ban pointed to overwhelming medical evidence that these practices are ineffective and harmful. Opponents framed conversion therapy as speech not conducted, therefore states were and are enormous. The ruling undermining state bans could roll back protection for millions of LGBTQ plus youth and reopen the door for both licensed and unlicensed providers to resume these dangerous practices. And these legal cases aren't just policy debates. They represent human stories of survivors who were subjected to forced immersion therapy, degrading role play sessions, religious coercion, or in extreme historical cases, psychiatric abuse, including institutionalization, invasive psychosurgery, or hormone manipulation. Many survivors never brought their cases forward. Many could, but the ones who did carved out a legal and moral reckoning that continues to reshape how the world understands and confronts conversion therapy. Today, courts and legislatures remain battlegrounds. Every ruling and every statute reflects larger cultural shift, one that recognizes the rights of LGBTQ plus people to exist without being told that they need to be fixed. As the legal landscape shifts, truth remains clear. Conversion therapy is not a treatment, it's a violation, and survivors are no longer silent. So we're still fighting through it.
Yeah, I just actually, Amy, I just heard a story today. I was listening to a show that we both listen to and like, and I heard a story about a Broadway actor. He was actually in Hamilton, which I love. His name is Zelig Williams. He went missing 1 year ago on October 3rd, 2024. He went missing. He's still missing. Police suspect like foul play, and he was seeking conversion therapy at the time. So I'm not saying conversion therapy killed this guy. I'm saying I know it's still going on because this guy who went missing, they found out in his journals that he had been attending a new church, and he was, he felt like his homosexuality was something that now was something he struggled with, a sin, whatever. And he started seeking conversion therapy through that church. And then he went missing around the same time. I'm not, like I said, I'm not tying the two together. I'm just saying it's still going on. So, yeah, I guess, I don't know. I mean, what are your thoughts on all of this? This has been rough.
Yeah, this has been really rough. I did have in my notes that throughout some of this research, I feel like it's very telling the people who are speaking out against homosexuals so loud,
Yeah.
trans people, like, it's very telling.
Yeah.
Like, yeah, you really gotta think something about them and how they view
Yes.
their own feelings
Well,
and
like, the
like,
whole, what was it when drag queens were coming under fire for reading in libraries to groups of kids or whatever, underage people or whatever? And it was like, drag queens are in costume and they're reading to your kids. You're the one sexualizing it. You are. Those kids are. The drag queens are not. You are.
you know,
Freak. You know, like, that's how I feel. When people get up in arms about this stuff and they start lumping their own kids into it, it's like, why are you all of a sudden sexualizing everything in your child's life? It's fucking weird, bro.
yeah.
Weird.
Yeah, there are some drag queens who do present a little more sexual than others, like with the dances and, with like their movements and maybe some of the things they sing about. But as a whole, the experience is not sexual.
Yeah.
It's something for them to
And that's
themselves.
also like if you're going to their show at a club, you know what I mean? Like if you're going to like a comedy show with them or something, if they're going to a public library at 11 in the morning in just their getup, I doubt they're doing like some kind of strip tease. You know what I mean? Like it's just not happening. Like I'm sure because they're entertainers, they know how to shift into other characters. I would assume, you
Yeah,
know?
and if you were to think about, like, other cultures and they have people who are dressed up and they are also having shows, like, if you were to think about, like, the gay shows from long ago, and I mean, it's not long ago, they still have gay shows, but they are not, and yet their main thing was to serve people sexually. Um and they were dressed head to toe, heavy makeup, they were singing, they were dancing, they were performing, and they were serving, and yet people are, they're upset because that it's men and they're dressing up and they are expressing themselves,
Mhm.
and it's really telling how more offensive people are against homosexual men than homosexual women or
Mhm.
like, really anybody else. Like,
Right.
it's so fucking bizarre to me. Like,
Yeah.
it's like it's an art form. Like, They are they are getting dressed. There's fashion. There's makeup.
Well,
There's
right, and also just because somebody does drag does not mean that they're homosexual, and also women can do drag too, and women can also do drag and present in a feminine way. They don't have to necessarily cross to like a male persona. They can do drag in female and it's still drag. People are so ignorant of what drag is actually is, I think. You know what I mean? Like where I fucking hate it. I'm pissed at all of them for being
yeah.
so ignorant about all of this stuff, you know? Because homosexuality has been around since the dawn of time. We have evidence of this, guys. In fact, your precious Last Supper painting, painted by a homosexual, just FYI. A true homosexual man who had a lover. He is the one who painted the Last fucking Supper. I can't. The one that, the famous white Jesus painting that's in a whole bunch of houses, he also painted that one. So it's ignorance. It's real ignorance, you know?
In a world where you can simply mind your own fucking business
Yeah, thank you.
and you decide to bitch about what other people do in their own fucking time, are you kidding me?
Right. And it's, guys, like, I can't say it enough. I had to say it multiple times, but I'm going to say it again. Homosexuality is not a fucking disorder. It isn't a disease. It never has been proven to be one. Um, there isn't a way to treat it. There isn't a way to subvert it or convert it because it's not a fucking problem. That's it. I don't know how else to say it. Like, get the fuck over it. I'm over that shit. I'm done. I can't hear them anymore about this. I'm so upset that gay people of whether you're bisexual, you're transgendered, you're lesbian, you're questioning, whatever. The fact that you still have to fight for rights, for basic human rights in this country and abroad is fucking laughable to me. I can't say it other than that. It's laughable to me. It's sad and it's a joke. Are you kidding me?
And I also want to bring up again, the louder you are about gay people, trans people, the more we just think that you're in the closet. Real far, real deep in that thing.
Right. Right.
So learn to mind your business and
Yeah.
learn to shut the fuck up. And if it's not bothering you,
Even if it is bothering you, shut the fuck up. I don't care. Like, I don't give a fuck. Shut the fuck up. Keep it to yourself, Karen. You know what I mean? Like, I don't care.
don't be gay. You just do that and shut the fuck up on it.
Yeah, you
Like,
don't like gay people. You don't want to be gay. Don't be gay. I mean, I'm not gay.
to me, if it's Meg Thee Stallion, okay, I mean,
Well, okay. I mean, I could be convinced, I guess, depending on who it is. Maybe I'm a little gay, but I don't hate either, because I don't give a fuck. I got too much shit on my plate. I got too much to do. My day does not revolve thinking about what other adult people are doing in the bedroom. It just fucking doesn't.
it's bizarre that there's people
It's a weird thing to be fixated on. What? The gays. I'm like, and then this, and then this, and I can't. It's like, shut the fuck up. Like, get out of here with that. I'm so upset about any of the anti-gay stuff. And I know we're going to get into other subjects in this kind of category. There's a lot of stuff when it comes to civil rights atrocities of the LGBTQ community. This isn't even like 5%, I don't think, of what's been done against them.
like I was saying earlier about the forced sterilization that
Yeah, I know. And it makes
this
me bummed because, like, why do you care if somebody loves somebody else? What the fuck do you care, man? I just can't. I can't. So any crime against somebody based on that is, like, especially awful to me. You know what I mean? I don't know, but I guess we should wrap it up unless you have other notes.
could sit and bitch for easily like another hour, but that's all my
Yeah.
notes that I have.
Yeah, we actually had to extend our research for this one an extra week because, like, it was a lot. And we had to, I think, both of us had to edit a lot down because there's just so much. We obviously didn't get into a lot of like specific cases because it would just be, I mean, you can't, you know what I mean? It's hard for us to do it in our format of how we do our show.
If we were to go into alone the hate crimes that have been committed, not just the conversion therapy, but the actual hate crimes that have been committed, like especially with the uh corrective rape, like I
Oh, we could talk all day. We do like 4-part series on that alone. Yeah, immersion therapy alone could take like two parts because there's so many different cases where they used aversion therapy to people's detriment, meaning aversion therapy was conducted and then somebody left so much more upset than they went there with, seeking some kind of help, that they killed themselves. And a lot of these were youths, guys. Like a lot of these are adolescents. Like we're
you know,
not, it's ridiculous. But we're not going to keep talking your ear off about it. You know it's bad. We know it's bad. And if you want us to talk more about it, like we said earlier, we can always dive back into it and break it down even more and give you guys some of those more, those examples. But you guys are troopers for hanging in there with us. If you still are here with us, you are troopers. This was rough. And we didn't mean to do it this way. We didn't mean to end the 4-parter. No, I don't think rhyme or reason. We just kind of pick 4 in a subject and we go for it. But this one to me was probably one of the tougher ones of all 4 episodes in this series. Yeah.
so this
Anyways,
is to our crimes against humanity, section. What is our next?
so the
You want
next, huh?
to tease that a little bit?
Yeah, the next series we're going to jump into is social justice stuff. So I'm not going to tell you what all the episodes are, but we can tell you the first one is we're going to be covering Me Too and the Me Too movement and everything that went along with that. So, and is still going on with that, I should say. And the truth of Me Too, because I think there's been a lot of misinformation out there, and there's been a lot of people don't know much about the beginnings of it, I don't believe, as much as people should know. And so we are going to get into that. And also, we're, of course, going live next Thursday at 8 p.m. Central Standard Time. You can get all of the information, all past episodes, and links to our live merch, all of the stuff at This Just In and it's grim.com. Yeah, that's all I got. You got anything else? Alrighty. Well, we'll talk to you guys later.
All right.
Bye.